Like this is not very clear. Okay, I don't understand here. Hello, everybody. Good afternoon again. Can I get a wave from everyone, so I know everyone is paying attention. The teacher and me. All right. So much in common with Michael. She came here with her husband because we like traveling. I'm also here with my husband because we love traveling and we're trying to go around the world. And it's so beautiful to see everyone here and to know that everyone is from a different place. So don't be surprised if you come to India, Pakistan, China, all the countries that celebrated their research here. It's such a pleasure to see two Hausa boys from Nigeria, the northern part of Nigeria today. It's an amazing thing because Hausa men don't travel a lot. So if you're traveling, you're probably very educated or you have a lot of money. As a businessman in Hausa pop culture, they're very communal and they're very cultural in their way of being, and they're very conservative in their place. You can nod your head if I'm right, or you can say no if I'm wrong. So it's good to see you, and well done, welcome to the afternoon session. So today I'll be sharing, not for long, part of the case study from my PhD study, just like my sisters have done here. So I just want to introduce myself again. I'm the senior lecturer in public health. My school is the School of Health and Social Wellbeing. I'm also a senior fellow in higher education. This is why I'm a practice educationist or educator. I'm an academic leader in student success, so I like to see students succeed. I've done what we call the access and participation and progression work before for 3.5 years at another university. And I think what I want to emphasize today is my community development expertise. I'm very community oriented. I like to work with community workers, I like to work with local authorities, and I like to work with every department, every work that is done in community. I have very good sense of how it works. And I've worked in community development for over 10 years. And also, I also work in the church as well, so I have knowledge of how we can religion and faith-based systems can help with community development work. My focus is really on improving outcomes for the represented groups, just name them, any vulnerable group, any group that is traditionally disregarded or overlooked. So today, I'll be sharing my PhD with you. So as I said, this is the case study from my PhD that was awarded in 2022. My research was conducted as part of what we call the Well London program. It's a big multi-component community development approach. And when you have a community development approach that is multi-component, it's really difficult to find out what exactly is improving health and well-being. So I worked in this program for 3.5, 4 years, in fact, I think more, because I started to work there and then I started to do a PhD on it as well. And the reason I did my PhD is people coming to the program, head bowed, very unhappy, and not wanting to engage. The body language is just not friendly. But because we allow them to have interaction with each other on a table to discuss what is good about their community. Community people don't want you to tell them that their community is bad. They live there, they enjoy living there. But they best know what the problem is. And we go there with what we call the asset-based method, where we say, oh, we've got this beautiful space. How would you like to use this space to improve your community? And then you see people start talking, even children start drawing on the white table, the white tablecloth on the table, and they start telling you how they want their community to look at. So, While London is sponsored by big lottery, so not government funded, it's just a charity that funded this. We gave £10 million over the course of 6 years, and we worked in 30 boroughs. But when we started to work in Tottenham, which is a North London borough, we collaborated with the University of West London. At the time, the money was going down, so the local authority there had to contribute some money. And we worked in the Tottenham Park, which is a very deprived community setting. And in 2018, the Office for National Statistics mentioned that we had life expectancy of 1.1 years. So Tottenham was good about it, was bad. What they want to see, how they want their communities to improve, who is left out. So it might be young people, it might be women having difficulties in relationships, or in violent relationships, it could be men who do not have any jobs, it could be homeless people. So that's what participatory budgeting will be like. So the reason I do this work is that the private communities often face very difficult time. The lab agency, the lab boys, they often have what we call learned helplessness. And to drive change is really difficult for them. And Mammoth 2010, we also have Mammoth 2020 that looked at how inequalities can improve. And he suggested that people should have the right to speak about their community, because communities are experts in their own problems or in their own community. They know what is best for them. So let them have the agency and control to decide their destiny rather than the health professionals. So, and we know that autonomy, and that's why I was arguing with that Jane yesterday, that when she said, I asked her the difference between personhood and autonomy, and she said autonomy is not important. Autonomy is a very important need. If I take your autonomy from you, your decision-making power from me, you get upset. If I say, don't go across the road, and you want to go across the road, you will be so upset. If I say, don't look back, some of you will look back straight away because I'm going to take your autonomy from you. So autonomy is a key factor for well-being. And when well-being is interrupted, it disempowers the person. So while being interventions are actually empower communities to make decisions about their own health, it helps them to get sustainable change. It helps them to take ownership of their own lives and their own health. So PD is an intervention that makes that happen. It allows people to choose what projects that they need to see in their community. And you know that theatre arts, when you go and watch a cinema, even if I'm not in the cinema and I'm cracking jokes and making fun here, it makes you begin to feel well in yourself. So I wanted to understand the connection between how participatory budgeting led to this project, why the communities did not choose a full intervention. They decided to choose a theatre intervention in a very deprived community where food is number one. They chose this. So I wanted to understand, how would I understand the residents' decision to do that? To choose a drama and a theatre project rather than food. And when I was in my PhD, I was trying to do a systematic review on what the impact of participatory budgeting was. There was no systematic review. I struggled writing, trying to look for papers to do the systematic review, but it wasn't available. I went to a conference, discussed with colleagues, and they eventually wrote this paper without me. Handel et al. Looked at that there's so many, maybe 27 odd years at the time, and there was no paper showing us the impact of participatory budgeting on health and well-being directly. We had some on inequalities, we had some on infant mortality, the link between infant mortality and participatory budgeting, but nothing we had the contributions to changing its road pavings and all that. But when we have road pavings, when we have hospitals built, like we have in Brazil, we have in the US now, the US has lots of participatory projects in experiments. Why can we not measure the health? So I was asking that person, what's the link between this people and the interventions that were decided and how these improve health? I'm not going to talk you through this. If you want to know about it, you can talk to me later. This is what we call the well-known framework, or well communities with framework. It's not well communities to be well London because it was just in London, but they are trying to expand to different parts of the world. So what happens here is there's a community engagement process, there's a community development and capacity building where you train the communities to make ideas, let their ideas. People of us have ideas, we're very creative. But just imagine someone giving you money to make your ideas come to life. That's what happened there. And people just chose to do different kinds of projects. There were so many projects going on. And I think it comes up to the point where they now create a participatory body to the event. Someone trains them for a year or so, 3 months, and then they decide and they create projects. You can talk to me about this later, I don't have much time. So this is what participatory bodies look like, where the community is saying, hey, they should be talking to us, right? And this is local council trying to do their own thing. So this is how participatory budgeting day looks like. People coming into the center, having fun, music, eating, and you pitch for 3 minutes about your project. And this is the community choosing the projects. You see, they're happy, they're choosing what they like. So they will choose dance, events, things for young people, and that's how this theater came up. So when I interviewed lots of people for the whole project, but for this particular project, there were 18 people in the community, and I looked at those who were involved in the process of choosing the project, the drama workshops and rehearsals and the play. And then the people who didn't work in the area, participants were all different because I used the more what we call the I use composite sampling, but I use multiple variation sampling, where sampling everyone. Okay, so I'm not going to be able to talk much about this, but I stayed long in the community, just making sure I understand what was going on. So I use different methodologies, case study, observing people, and collecting data about different methods, including semi-structured analysis, documentary analysis, and just being part of the community as a participant observer. I use what we call the constructivist grounded theory by Chamas. This gives power to the voice of the individuals I'm interviewing because they are underrepresented. They have power in their voice to express themselves, and it helps me to think about, to be very reflexive. So when I'm doing my analysis, I'm not speaking for them, but using their own words. So some of the things that came up, and I'm going to just read one because I don't have time. TV enables awareness from, because it's money, and you're putting it in the hands of the community, it trickles down to them. When the money gets to their hand, what they do is they feel emboldened and empowered to deliver the projects. And they are so committed and become, they have ownership. The community itself feel that this project is our project. And they are overseeing the project by coming to see what the person is doing, making sure the person is doing the right thing, but also keeping them accountable, keeping them transparent, but contributing through volunteering, through anything you can think of. These are some of the findings. I found it really hard to make this because I was trying to make it pretty, but this is what I got overall. Light bulb moment for them, positive relationship the affected the design, impacted the design. They could not do anything that was not democratic. And also, it's caused a lot of healing process for the people. Catheter, people were crying and releasing pain from years, trauma from years of oppression. All right, so the implication of the study is that PB is very useful for as a co-production tool to allow participation. You know me, I'm all about participation. So this was really interesting for me and I enjoyed the process. PB influenced the design and the delivery of the interventions and they helped to meet the needs of participants, their direct needs. It's not what we call council budget, but their direct needs. It's very important to have culturally arts or culturally aspirational projects because it enables communities to heal, individuals and communities, and it can help raise awareness for health, it could bring something like money. All right, currently, in fact, yesterday I got an email that this paper is going to be published in 30 days. So there's a future for the paper. Thank you. So the future was actually to collaborate with national, regional, national, international bodies to get money to do more projects. Because the money is, there's no money in the system, but little money goes around when it comes to people. So if I can get some projects in around the region around my area or even internationally, I'll be very happy with that. I've already started speaking to people here. This is why coming to the conference is important. So we will work towards sustainability in terms of money that will go into the community. I just want to say thank you to my co-authors who were my supervisors and some supervisors that were left along the road. Having the council well participants and the UB team, Adele and Jed, who sponsored my coming to this conference. I just want to thank you so much also for listening. And my reference is, thank you. Any questions?